Hi, I'm naturopathic Dr. Samia McCully, and today I'm here with Stephanie Kerst. This is the fourth in our series about different symptoms that EMF can cause or contribute to. Stephanie is an expert in EMF. Stephanie, I think we've given enough recaps that we don't need to talk about it today. What symptom are we talking about today?
So today, let's talk about ringing in the ears, also known as tinnitus. If it's something you suffer from, you know that it can be annoying and also just really detrimental to health. So let's talk about tinnitus and EMF.
Okay, so what does EMF have to do with tinnitus?
So there are many studies that show that cell phone use, and most of us have and use a cell phone, affects our auditory system, both in terms of it can affect our hearing, sometimes causing hearing loss, but it can also result in ringing in the ears. And one of the most relatable or best client stories that I can share with you is a friend of mine. We were on a river trip. We were in a wilderness area and there was no cell service. And our cell phones were wrapped up and put away in waterproof bags for a week. And the friend of mine, who has a busy job working in San Francisco, he's on his cell phone all day, every day, came to me about the third or fourth day. And he knew that I was a building biologist. He knew that I did a lot of work on EMF and health, but we never really talked about it. And he came up to me and said, Stephanie, I have to tell you, I have suffered from ringing in the ears for years. And I've sought out so many doctors, so many alternative healthcare professionals, and I've really found no relief. But what I've noticed in the past couple of days, once I stopped using my cell phone, the ringing in my ears has stopped for the first time in years. This was, quite a compelling experience, and you could see the relief in his face. And that was enough for me to know that, if you are someone who suffers from ringing in the ears, perhaps, looking at strategies to lower your cell phone use could be a really good way to go.
Yeah, it's funny because I think in Western medicine, everybody wants to add something. We don't think about removing things that could be the cause of something that we experience every day. And it's so normal to use cell phones, you wouldn't really think of it because there's such a, it's kind of like we have blinders on about it. So, what could we do besides reducing cell phone use? I mean, your friend still has to talk on the phone all day long. So, what should he do?
Yeah, so let's be realistic about it,
Yeah.
right? Minimizing use where you can is always a great strategy. It's that reductive strategy, like you talked about, taking something away that might be causing a symptom. Even something as simple as using speakerphone or texting, essentially trying to get away from holding the phone to your head during a call, can go a long way in increasing distance, getting the phone away from your head. You could use a wired headset, ideally not Bluetooth or wireless earbuds, but a wired headset. And even some of us, if you live in an older home or work in an office, might have access to a landline. So, do the best you can and just look for ways to minimize cell phone use or find healthier options and see how it affects the ringing in the ears. And hopefully you find some relief.
Okay. And you know what I will say, if you're watching this video and you don't have tinnitus, share this video with everyone you know because people don't talk about tinnitus. It's something they'll tell their doctor, but they don't complain about it to their friends or their family usually. So you may be helping someone who's secretly suffering with this. And believe me, I know from my patients who have tinnitus, it can be really crazy making. So if there's something that could bring them relief, they just don't know about share this video. Okay, Stephanie, what are we going to talk about next week?
So next week, let's talk about a big one. Let's focus on fertility. And when we talk about fertility, most of us think about women and reproductive health, but let's talk about both male and female infertility because, both either one can be a factor and EMF exposure can affect fertility.
Yes, and I will say, just to add my 2 cents, that 33% of the time the man is the problem, 33% of the time the woman is the problem, and 33% of the time both the man and the woman are a problem with fertility. And male fertility does not really get addressed as it needs to. And so this is a really, really important topic to be talking about, especially since so many people have fertility issues these days, and it's just really, it's getting worse. And I do think that EMF is one of the contributors to that. So, okay, this was great. And we will see you next time. Thank you, Stephanie.
Thank you.